Hello, good afternoon. My name is Shruti Bhandari, SWD from Marwad University. So today is my topic is short wave of diathermy, setup for solder joint compressing disc electrode and versus pad electrode. So first of all, introduction, brief overview of short wave diathermy SWD. The shoulder joint, also known as the glenohumeral joint, is the ball and socket articular between the humerus, upper arm bone and the scapula, shoulder blade. So use of SWD and shoulder joint of therapy. So help relieve pain, reduce muscle spasm, improve range of motion and decrease inflammation. Electrode type in SWD. So two main type of in SWD. So first is the disc electrode and second is pad electrode. So first of all, this electrode, disc electrode is shape and design is circular metal disc and shape electrode. Application often use a capacitive method of SWD. Placement. So positioning on either side of treatment area with air gap between electrode and skin. Heating effect. Heating is mainly generated in the superficial tissue, skin and subcutaneous fat. Advantage. Effective for treating a superficial structure and adjustable distance, allow for control over intensity. Disadvantage. Require carefully posting and spacing to avoid burn. Less effective for dipping tissue heating. Then pad electrode. Pad electrode shape and design is a flexible pad with insulated covering, often flat of slightly contoured. Then application, commonly using an inductive method of short wave diathermy. Placement, applied directly over the skin and with minimal padding. Heating effect, heating is probably mainly produce mainly deep tissue and particularly muscle. Advantage. Better suited for deep heating, less risk of superficial burn to insulation. Disadvantage. Less effective for superficial condition, less control of over gap compress and disc electrode. Then set up for shoulder joint using disc electrode. So first of all, description, circular metal electrode, then placement, direct contact over the shoulder region, typical posting of the effective treatment and advantage of focus, energy delivery, perception directly. Set up for shoulder joint using pad electrode. Description, flexible larger surface area electrode. Placement, vapor place around shoulder area, posting of cover larger treatment area. Then advantages, uniform heating, better of larger of irregular surface. Then features, disc electrode versus pad electrode. So heating depth, in disc electrode is superficial and in pad electrode is deep. Then application method. So application method is in disc electrode is capacitive and in pad electrode is inductive. Then risk of burn. In disc electrode risk of burn is higher, in pad electrode risk of burn is lower. Then control over heat. In disc electrode heat is produced more and pad electrode heat is produced less and directly. Uses of case, in disc electrode skin and joints and pad electrode muscle and deeper tissue. Thank you.